A significant shortage of funding is threatening the closure of many health facilities in Yemen, potentially impacting millions of people, according to the UN reports. This funding crisis is jeopardizing access to vital healthcare services, including treatment for malnutrition, infectious diseases, and other life-threatening conditions. The situation is particularly dire for children, women, and displaced populations who rely heavily on these facilities. More on this story is in the following report.
Yemen's health system is on the brink of a collapse. After years of war sparked by the Houthis, nearly half of the country's medical facilities have been forced to shut down. Now, the United Nations is warning that without urgent funding, an additional 771 health centers could soon close, leaving nearly 7 million people without access to life-saving care. The UN Office for the Coordination of Humanitarian Affairs reports that more than 17 million Yemenis, almost half of the population, are suffering from acute hunger. Malnutrition remains widespread in every governorate, affecting 1.3 million pregnant and breastfeeding women and more than 2.3 million children under the age of 5. Without continued humanitarian support, the UN warns up to 6 million more people could fall into emergency levels of food insecurity. Despite these challenges, the UN says its teams continue to deliver aid in a difficult and often dangerous environment. In the first 3 months of this year alone, over 4 million people each month received some form of life-saving humanitarian assistance. During that time, 4.7 million Yemenis received regular emergency food aid. Nearly 90,000 people were supported in agriculture and fisheries, critical lifelines for food and income. Health and nutrition services also remain essential. Over 262,000 children and pregnant or breastfeeding women were treated for moderate acute malnutrition. Another 77,000 children received treatment for severe acute malnutrition, and more than 51,000 women were assisted during childbirth. Meanwhile, 2.4 million outpatient consultations were provided to displaced Yemenis in host communities. Also, efforts to fight cholera continue, with support for hospitals and diarrhea treatment centers, training for healthcare workers, and the distribution of diagnostic kits. Yemen's crisis goes far beyond health and hunger. The UN warns that the country is grappling with multiple overlapping challenges: political instability, economic collapse, and the worsening impacts of climate change. Together, these pressures are pushing vulnerable communities even closer to the edge. The UN emphasizes that while humanitarian aid is vital, it is not enough on its own. There is an urgent need to scale up long-term development support, ensuring access to basic services, creating sustainable livelihoods, and helping communities build resilience before conditions deteriorate even further.